Hi guys, welcome to Radiology 365, where we try to cover core radiology from cover to cover. Today we're going to be talking about infections in the immunocompromised. Immunosuppressed patients are susceptible to the same organisms that infect immunocompetent patients, but we must be aware of several additional opportunistic organisms that may present in the immunocompromised. An immunocompromised patient with some focal airspace opacity is likely to have some bacterial pneumonia, but TB should also be considered, especially if the CD4 count is low. The most common bacterial pneumonia that may occur here could be pneumococcus. Contrast to the focal airspace opacity, when you have multifocal opacities, your differentials should be more broad. So you can include pneumocystis pneumonia and other opportunistic fungal infections like cryptococcus, aspergillus. So these opportunistic infections we have mentioned, i.e. pneumocystis, cryptococcus, and aspergillus, are the ones we are going to focus our discussion on today. So pneumocystis jirovecii, previously called pneumocystis carinii, is an opportunistic fungus that may cause pneumonia in individuals with CD4 counts well below 200 cells per cc, or some T cell deficiency, especially in a case where the patient must have had some bone marrow transplants or solid organ transplants. The incidence of pneumocystis pneumonia currently is said to be decreasing, and apparently this has been attributed to routine antibiotic prophylaxis. You may have normal chest radiograph for patients who have pneumocystis jirovecii pneumonia, but a classic finding is bilateral perihilar airspace opacities, which spare the peripheries. On CT, the classic appearance is ground glass opacification. Sometimes you may have crazy paving appearance. And you remember from our previous lesson that crazy paving is a combination of ground glass and thickening of the interlobular septa. A normal CT tells us that the patient does not have pneumocystis jirovecii, but a normal X-ray does not mean the same thing. Since pneumocystis pneumonia can hide in a normal chest radiograph. Pneumocystis pneumonia has the propensity to cause upper lobe pneumatoceles, especially if it's left untreated. And these pneumatoceles, if they rupture, you may end up getting pneumothorax or pneumomediastinum. So in this CT here, it shows crazy paving with confluent ground glass attenuation in the upper lobes. You see this ground glass opacity with interlobular septal thickening, and it's diffusely distributed bilaterally. And some of the ground glass opacities are confluent. In the axial CT below, this is of a different patient, and this patient also has pneumocystis pneumonia. It shows asymmetric ground glass opacification with thin-walled cysts. So we see some areas of ground glass opacification here, and then worse on the left. And within this, we see some cystic areas. Cryptococcus is an opportunistic organism, and it's the most common fungal infection in AIDS patients. Pulmonary infection with cryptococcus usually coexists with cryptococcal meningitis. Now, typically, in patients like this, the CD4 count is less than 100 cells per cc. And in the immunosuppressed, this infection can have a very wide range of appearances, ranging from ground glass attenuation to focal consolidation, even to cavitary nodules. It can also present as miliary disease and often is associated with lymphadenopathy and effusions. So in this image, it shows widespread ground glass nodules. You can see some in the left and in the right, these ground glass nodules. Some of them have central solid components, and on the right side, we see one of the nodules with a central cavitation. No lymphadenopathy or effusion was seen in this case. The other opportunistic infection we'll talk about is pulmonary aspergillus, but would reserve that one for its own talk. That's going to be our next topic. If you are finding value from this discussion and from these series of lessons, kindly give it a thumbs up, subscribe to the channel, and hit the notification bell so that anytime I upload any video, you will receive a notification. And on that note, I'll see you in the next one.